Good morning, good afternoon, good evening, and good night, friends and colleagues from across the world. Thank you for joining us for our second special edition Podinar of the weekend. We have four coming up with two very special doctors who have graciously donated the time to bring some knowledge to us today. Dr. Emily Letron, who will be our host, and Dr. Allison House, who will be our speaker. Welcome today.
Thank you so much for having us.
So I would like to make an introduction of Dr. Letron and give you guys a little background of our host for this special edition session. Dr. Letron just recently also published a book, and as I had stated in the endorsements of this book, that she has been always around since the days I can remember in supporting other dentists and bringing knowledge and motivation and education to our colleagues. And she does it often restlessly and selflessly, and we are very appreciative of that, Dr. Letron.
Thank you so much.
So who is Dr. Letron? She's a serial entrepreneur, CEO of multiple dental practices, and private coach to many professionals. As an international speaker on several continents, she has been on TEDx and shared stages with countless business and, frankly, dental leaders, including Sharon Lecter, co-author Rich Dad Poor Dad, Dr. Howard Fran, Dentaltown, and Linda Miles, the ultimate mentor of dentistry. She has been featured on Dentaltown, Global Woman, See Beyond Magazine, and Asian Voices of TV K24. She's a contributing writer for Dental IQ and Dentistry Today. She's also a founder of Exceptional Leverage Inc., a coaching and consulting firm, Action to Win seminars, which I had the honor and pleasure to present for this year. And she's an Amazon bestseller of several books. Her most recent one was very exciting about empowering our female colleagues. She leverages her training and marketing experience owning multiple dental practices for more than 23 years to help dental professionals maximize their potential, streamline their business, and increase profits while maintaining a happy personal and family life. And that was a key of the teachings in her last book on how you can balance all of those things. And Dr. House will be able to give us a little input on that as well. She also, if that's not enough, operates a non-for-profit, the Emily Letron Foundation, that gives back to the community through free dentistry days for veterans and families of disadvantaged background. She never forgets her old challenges coming to the U.S. as a refugee from Vietnam. At the age of 13, without her parents, I can relate a lot to this. Learning to overcome the language, cultural, and financial barriers, and finishing her DDS and MS at UCLA Dental School in the same 4 years. Yep, Dr. Letron believes in giving back, and her actions speak louder than words ever could. Well, Dr. Letron, the dental community is very proud to have members like yourself and Dr. House that actually are fighting for us. So with that said, I'd like to go ahead and disappear, and you have the floor to begin the session. Thank you.
Thank you, Dr. Shah.
Thank you.
Good morning, good afternoon, good evening to all of our friends and colleagues all over the world. I'm Dr. Emily Letron. I just wanted to add that I'm the best mom in the world. And it's my absolute honor to be hosting this podcast today. I'm welcoming our colleague, Dr. Allison House. Dr. House graduated from the University of Alabama, Birmingham. She's in private practice in Phoenix, Arizona, where she has her own solo practice. She began a long leadership with as Arizona Dental Association, beginning as the chair of New Dentists program through the Council on Membership. Then she moved up as the treasurer and then became one of Arizona Dental Association youngest and most accomplished presidents. She is currently the speaker for the ADA Success Program and serves on the ADA Council on Dental Practice. Dr. House is a fellow of the International College of Dentists. She is married with 2 adult children, and she shares her passion in dentistry through her podcast, The Authentic Dentist. Dr. House, good morning and welcome to our podcast.
Good morning. Thank you so much for having me.
Oh, you're very, very welcome. I'm so excited that we get to connect again. I remember the first time meeting you was about a little bit more than 2 years ago. I did my first Action to Win event for dentists in Arizona, and you had come and graciously served as the master of ceremony. And then, of course, you recently joined us on our real virtual uh, event that we just had back in back in August. And so today, I'm really grateful that you're coming on to talk about ethics. And let's just, before we get into that, can you share with us what has, I would say, trigger you to decide to get involved in organized dentistry?
Well, I became a dentist because of my dad, and he's not a dentist. He was diagnosed with oral cancer when I was a junior in college, and our family dentist diagnosed it and saved his life. And he actually just passed away about a month ago at 82. So he had a long life. It was amazing. So I changed my trajectory and decided I was going to go to dental school. And I had to actually sit out a year. And I went to the University of Alabama, and I had 2 kids while I was in dental school, which was crazy.
Well, that was brave.
I don't know about brave, crazy, but I did it. I graduated and I came out and I worked for a couple of corporate practices. And the corporate practices I worked for didn't do things exactly the way I had learned in dental school. And I remember being pretty concerned about that. So my parents were very involved in the Arizona Physical Therapy Association. In fact, both my parents had been president at one time. And so they encouraged me to write a letter. So I wrote a letter to the Arizona Dental Association about my concerns. And I don't know, my journey just started there. And it wasn't long before we were writing laws for Arizona on corporate dentistry. So I've had a long time in organized dentistry.
Well, thank you so much for sharing that. I think a lot of us, we have those moments where we make a decision, we pivot, we change, and it's very, at this time right now, I think it's one of those moments for many dentists when life just abruptly changed, and we decided we need to do something different. So while you have 2 children in dental school, and then you come out, you have your private practice, and I'm sure, just like all of us, you have those challenges with your staff and maybe with, the colleagues and people practicing around you. How do you find the time to join the ADA and be an active part of that?
Well, I mean, I know you do this too. You make time for things that are important to you. You know, your story is always so inspiring because you did so many things that it just impresses me. You overcame all these obstacles, and you just do what's really important to you.
Right. So that takes us to what you're going to be discussing about ethics, because sometimes it's easy to say this is the right thing to do, but what's what is common sense may not be common practice. What we know that we should do, sometimes we just can't do it. One of my favorite marketing instructor talk about situational ethics, right? You know what you're supposed to do, but when it actually you're in boiling water, then what do? You still do what you know you're supposed to do, or maybe you just do the easiest thing, or maybe you go to somebody else and ask them for ideas on what to do, even though you know what you're supposed to do. And I know you also started your podcast, The Authentic Dentist, and I know that's part of where you share your wisdoms, your insights, and really your voice on how you stand on some of these issues. Can you tell us a little bit more about your podcast?
So it's been about a year since we started the podcast, and my partner's name is Sean Zayas. And we talk about all the challenges that come along with owning a practice, being a dentist, and all the things you're talking about on running into challenges and what do you do? Who do you talk to? It's becoming more and more difficult to find mentors, I think, and especially mentors that really are interested in ethics. So I talk a lot about trying to find those people and trying to think through your way through problems. And I talk a lot about coaching too. My dad was a coach, an Olympic weightlifting coach, and how you coach your team, you coach your kids, coach yourself to be better.
How do your children feel about mom standing as the ethical dentist, the dentist who talk about ethics?
Well, my son actually was part of the first one that I wrote, What Do We Owe to Each
Okay.
Other? And so he's always interested in this. My daughter is off at NAU, Northern Arizona University, in her third year. And so she's pretty busy with accounting and psychology. And so she doesn't have time for all of this.
But how do they feel about mom being that person who take on that issue and share it with the world?
I think they're proud of me. I'm hoping that someday they'll walk in my footsteps.
Great. And so what do you do to inspire them?
Well, this is a family discussion at dinner. We have family dinner every Sunday night, and ethics is part of it.
Wow, that's very, very impressive. I think a lot of time when people have dinner, they probably talk about the fun things or maybe something they plan to do, but ethics is part of your dinner discussion, your weekly dinner discussion.
It is. It is. And how we can help the world. I was a Girl Scout leader too, and I feel like, our job is to make the world a better place. And you certainly got that.
Well, I certainly appreciate you taking the time to share your thoughts and your feelings, and obviously it comes from so many years of practicing dentistry. And when you're part of organized dentistry, you tend to see the big picture, right? It's not just the local community. You see the trends. You where there's frustration or complaints or challenges, you see it as a national issue, and then of course you can address things accordingly. And I'm really, really super proud of you for accomplishing everything you do. And I love to see your husband supporting you too. He was in your presentation last time we did Action to Win, and he was very instrumental this morning also. And that's what we do, right? We achieve success because we have people who support us. And I appreciate you and the ADA in supporting our organization, helping, whether it's a new dentist or a seasoned dentist, because ethics is part of our professional lives. We took the oath to uphold, all the ethical standards. And I'm sure there are days that some of us just feel like, I wish I'm not the doctor. I wish I'm not a community leader, so I can just do whatever I want and not worry about reputation or what, how people are judging us as a whole profession.
What does Spider-Man say? You with great power comes great responsibility.
Right.
That responsibility is tough.
Very true. But in your case, you sign up for the power. You have the power also, but you step up and you sign up for it, and so you already come with that determination and the commitment to help. And so
It's power, but it's service too. I feel like I'm doing something important for our association, for the dentists, and I'm making the world a better place.
Yes, absolutely. We want every one of us to have that servant heart to be a leader, but first is a servant. So thank you for taking the time to chat with me. I would like to give you the floor now so you can give your presentation, and I can tell you how timing this is, how good timing this is, that at this time where we all face some challenges, personal, business challenges because of the difficult time, the changing time. And it's really when it's not predictable, right? You don't know what comes next. I think those are the times when I'm working with my client, those are the time when I say, hey, you need to just revisit your values and think about what you believe in and then act accordingly. So Dr. House, you have the floor.
Thank you so much. And I'm so honored to be able to do this for everyone. So the presentation is Ethics on Dentistry. What do we owe to each other? So I've been lecturing to dental students on ethics for about 5 years through the ADA Success Program. And I actually started lecturing on ethics in 2004 when I was part of the New Dentist Committee here in Arizona. And it was at a local dental meeting. My lectures are usually about difficult patients, difficult situations. But this year, actually in January, I was asked to do a lecture for my state dental association in May. And when that happened, it was impossible to ignore the global pandemic. So I wrote, "What do we owe to each other?" because I felt the pandemic had changed everything. And it has. But as time has gone on and we're here in October, I've noticed that some of the problems are similar to 2019's problems. They're magnified because we're under so much stress. And I think sometimes we're not being kind to each other. So what I mean by this is when I lectured to dental students, we talked about difficult patients. And today I'm talking about scared patients. I was talking about practicing ethically. Now I'm talking more about practicing safely. So they're similar. We're still talking about the same things. So in May in 2020, it was clear that no one knew exactly what was going to happen. We were in the middle of a quarantine, and all of the places I usually went for information had conflicting answers. And you all know this: the WHO, the CDC, the ADA, FDI, all had different answers on how I was supposed to reopen my practice. And that was pretty scary for me. And I didn't know exactly what I was going to do and how I was going to go back to work. So we do have some answers now, but all of the agencies still don't totally agree with each other. And so I kind of feel like I'm my own in some respects as the science is still evolving. Now, it's important to know who regulates your license. In the United States, the WHO, the CDC, the ADA are not regulatory bodies. They're sources of information and best practices. American dental licenses are given by the state where you practice. Therefore, the state government regulates your license, and you have to follow whatever your state board says. So if your state board says you must wear an N95, then you must wear an N95. Doesn't matter what the ADA or the WHO says, because they're regulating your license. I also want to remind everyone that this isn't actually unprecedented. You remember AIDS and HIV? Now, I was a kid when HIV showed up, so I do have a child's perspective of this. But I do remember going to the dentist one day and suddenly everyone was wearing gloves and they didn't before. If you were practicing during this time, you probably remember the moment you decided you needed to cover all the surfaces you touched with saran wrap or aluminum foil. This is because we didn't have good science. We didn't know what was happening at that point in time, and we were trying to do everything we could to keep people safe. I do remember Magic Johnson had HIV, and other basketball players didn't want to play with him because they thought they could catch it just by being with him. And we know that that's not true today. Some other things that are similar to HIV is that lots of safety protocols came into dental practices back when HIV happened, and some didn't stick. We actually had face shields during this time, and then they sort of fell out of favor. And here we are again with face shields. The cost of dentistry has skyrocketed, and a lot of that is due to all the additional PPE that came from the AIDS epidemic. And now, of course, we have even more costs. At that time, dentists would post their negative HIV status on the office doors. And it's interesting that people want to know our COVID-19 status. People who had AIDS were considered to have dubious pasts and were often shunned because they must have behaved badly to have gotten this disease. Well, we're hearing the same thing now, where you must have been out partying if you caught COVID. And we know that's not necessarily true either. Finally, patients were afraid to come to the dentist because they didn't think it was safe. And here we are again, patients are afraid to come to the dentist because they don't know if it's safe. So what I'm going to do is to give you a framework on how you're going to make some ethical decisions when there aren't any answers. Now remember, if whoever your regulatory body has given you an answer, you must follow it. But our whole job is really about making decisions in real time with lots of variables, and we call it professional judgment. This is just a framework for you to analyze your professional judgment. And then you can make decisions that make you feel good, and it's not just a gut feeling. You have an analysis of what you're doing, why you're doing it, and what your true values are when you make decisions. So the two frameworks we're going to use are the rules of ethics and then some moral philosophy principles. And I just want to tell you that I am not a moral philosopher. I'm using this kind of loosely. So please don't write and tell me that I said it wrong, because I probably did. All right, so the first principle is called do no harm. And we know this. This doesn't actually mean that we never do any harm, because we know there are moments when we cause pain in order to help a patient feel better. It just means we don't do anything that would hurt a patient that is no benefit for them. We evaluate the risks and the benefit in every situation. The second principle is called patient autonomy. Now, this is always a fine balancing act for us. We know so much more than our patients, and we understand the ramifications of their decisions much better than they ever could. It's easy to act like a parent and not give the patient any room to make their own decisions. If any of you have parents, toddlers, or teenagers, you understand not giving any room for options can be a bad thing, because suddenly you are totally responsible if something doesn't go right. And your kid or your patient believes that you have to take responsibility even years afterward because they didn't brush their teeth. Ultimately, autonomy means the patient must be able to decide what happens to their body, and we must accept their decisions, even when they're wrong. The next one is do some good. And this is our whole job and why all of us went to dental school. We wanted to make people healthy. We wanted people to have their smiles back. We wanted to make it so they could eat and get them out of pain. The next one is to be fair. We must always be fair in our dealings with patients. And again, because our knowledge so far outweighs theirs, we can never take advantage of that gap and exploit people. We need to be fair in our dealings with finances, with treatment, and with options. And the last ethical principle is to be honest, or veracity. And this means we must always tell the truth to our patients, which sounds easy, but in practice, it's not always easy. I know that I always want to look like I am informed and I'm well educated. And there are times when there are no answers, and I have to be able to tell that to patients. I don't know the answer, or there is no answer, and I don't want to minimize or maximize risks to make myself look important. It's important for us to be upfront and honest with our patients. So now I'm going to move to some moral philosophy, utilitarianism, and deontology. So these concepts always remind me of the movie The Pirates of the Caribbean. The pirates in that movie had a code, the Pirates Code. It was a set of rules that every pirate had to follow, except when they didn't feel like it. And then they were guidelines. Deontology is when the code is set, and you must follow the rules to the letter. Utilitarianism is when the code is a guideline, and it can be altered to fit the situation. The next principle is moral particularism. And this is just for my purposes here. I know there's a lot more to it. I'm going to call it means the details matter. And my example would be the concept that people should not kill each other. In most countries, this is written into law. To a deontologist, this law is unbreakable. But let's say you kill someone who's about to kill your child. The utilitarian would say that is acceptable. The deontologist would say it is not. Moral particularism would say that the detail of your child being in danger changes the morality of what you did. That detail mattered. And the final moral philosophy principle is virtue ethics. And I picked Captain America because in the comic books, he always does the right thing. So virtue ethics, for our purposes here, is about doing whatever the most ethical dentist that you know would do in your place. All right, now we've got some framework. Let's start. What do we owe our patients? So let's just think about these concepts for a minute. The rules are written for patients. So what I've just gone through really does apply to patients. We know that today, autonomy means that patients knows the risk versus the benefit, and they know if they can wait. We don't do harm. Patient is safe. It's not the same as no risk. Infection control is best given in your situation, your community rules, and the patient's health. And we've done the best not to hurt the patient. Do some good. Patient needs this treatment, and not doing it would cause them harm. Justice. Patient is treated appropriately. Other options that don't have aerosols are not reasonable at this moment, or they're not appropriate because they'll cause problems later. Patient knows what they're getting into. And the veracity, the current knowledge is communicated truthfully. And knowledge is communicated without frightening the patient into or out of treatment. So let's put that in practice. I'm just going to look at a real world application. And this is something that's been bothering me a lot. We don't use any ultrasonic scalers in our hygiene department. And we don't because they create aerosols. So what are the ethics here? For my deontology, a lot of times I'm having competing rules. So I have a rule that I can't create aerosols. And that's a pretty finite rule. It's really important. But I also have this rule from dental school that I need to remove all the calculus on this patient or I've done a bad job. So these are competing rules. And we really have to think about what is the most appropriate thing to do in every situation using our professional judgment. The moral particularism is that some patients actually need the ultrasonic scaler because their periodontal disease is so significant. And the other thing is that some locations have more cases of COVID-19 than others, and so we might be safer. So there is some wiggle room here as we think about what we're doing. I'm not saying you should always use it or you should never use it, but we really take a moment and realize that you have competing rules here, and which one do you feel like you have to do in this situation? The justice part is, are we still within the standard of care if we don't remove all the calculus? And are we giving patients what they need and keeping everyone safe? And I just wanted to real quick tell you about the relief system. It's a high vacuum suction system that they use in hygiene. And I gave you a little picture so you could see it, because every time I come up with something different, I want you to know. All right, so here's another real world application about patients. What do we owe patients? Seeing our older and medically compromised patients. So we've been told that these patients should probably stay at home. They shouldn't be going out. They should be wearing an N95. And all of that's true, except that we know that being healthy is also your mouth being healthy. And so medically compromised patients oftentimes need to see us more often than a regular healthy patient. So again, we're at that, is this a rule or is this a guideline? Do we see these patients or do we not see these patients? Versus the risk versus the benefit. You know, is this patient able to be healthy or do we have to see them every 2 months? The moral particularism is, what if they have an infection? We know that if an older medically compromised patient has an infection, they will probably end up in the emergency room and they could even die. So yeah, we need to see those patients. That's an easier one. And we don't want them to end up losing any more teeth because their diet and being healthy is really important. There's also this little piece for me about justice. And I want to know that I'm not minimizing, I'm not saying there's minimal risk, just for my own benefit and my own practice. That I really do believe that I've minimized the risk for my patients and done the best possible job to keep them safe. All right, so now we're going to branch out a little bit and talk about what do we owe our team. Again, autonomy. So the team knows the risks and they can choose a higher level of PPE if they have a concern or there's something wrong. Oh, could someone mute their microphone? We've got some background noise. Okay. Yeah, so our team knows what's going on and how to take care of themselves. That's autonomy for them. Do no harm. We do not knowingly put our team in harm's way. paycheck. They need a paycheck. And this is important to them and it's important to us. Justice. We listen to our team's concerns and we do not expect our team to take risks we will not. And finally, veracity. This is the honesty about what we know and what we don't know. And there's systems to keep us safe. All right, so now we're going to go back to the real world application. So in my neighborhood at one point, we couldn't get N95 masks. So let's look at the utilitarianism and the deontology there. The rules in your location, if they say you must have an N95 mask, you must have an N95 mask. There's no discussion. But if that's not true, what are the alternatives if you can't get an N95 mask? Can you still? In my practice, we found the Bellis app, which is, you can download it from the App Store and scan your face and have a face fitter. And with my level 3 mask, between those two, I have a really good fit that'll pass the fit test. And so that's an option for me, but it may not be an option for you. What are the rules? There's also the moral particularism. So because you have an N95 mask doesn't mean it fits perfectly on the person's face. And we know that a large mask on a small person's face isn't actually making them safer. So there are some details here we have to think about. And then do no harm. You're keeping your team safe. And would you put your daughter or your son in their position? So you're hearing that I don't have the answers, and I don't want to ever even claim to have the answers. I'm just thinking about all the pieces of these ethical issues and how I'm going to apply what's important at the moment and my professional judgment in this situation. So here's another real-world application for my team. And this is the decision about wearing masks around each other when there are no patients. So in Arizona, we have a rule that you have to wear a mask in public, but you don't have to wear a mask, of course, in your home with your family. Well, my office isn't public, but it's not really my family either. So what are the rules here with wearing a mask in my office if it's just the 6 of us? We also know there's some moral particularism. Who are your teammates? And are any of them medically compromised? If they're medically compromised and you're going out to the bars at night, that's something you need to think about, that maybe you should be wearing masks all the time. And again, I always just want to point out that just like HIV patients, we really should stop blaming people who get COVID. We don't know if they went out to the bars or if they just caught it from a random stranger. Do no harm. What is allowing them to breathe? You have to think about these things. And then the justice is, what happens to the office if someone gets sick? If one person gets sick in my office, am I shutting down? Well, if we all wear masks around each other, then I don't think that we need to. But that's a big question. And we don't really have a good answer at the moment. So now, what do we owe our colleagues? And this is just more to think about. So autonomy. We know that all of our practices are different. We live in different places. We do different procedures. And so we really need to recognize that every doctor has a professional judgment, and we shouldn't be judging them without any knowledge. Do no harm. We shouldn't say bad things about another doctor, because it really just makes us all look bad, and that's really doing harm to the entire profession. Do some good. You know, recognize and say good things about good behavior in the colleagues. Encourage people. We do owe this to each other, and at this moment in time, it couldn't be more important to be kind and encouraging. Be fair about the difference in practice style, patients, and health. And I don't know if you all know this, but sometimes patients lie. And they'll tell you a story about something that wasn't exactly true. And so you're thinking something about another office that perhaps isn't true. Veracity, we need to acknowledge our shared challenges and know that no answer exists in some situations. So here we are with a real world application. And I'm going to talk about disparaging comments about the dentist down the street. So one of the things that I thought about was during the quarantine. So during the quarantine, we had this rule where we should stay home. And it was a pretty clear rule that they wanted us to stay home. We had a competing rule that we needed to be on call for emergencies. So there are some offices that stayed open for emergencies and some offices that completely shut down. And we need to recognize that those were competing rules, and they really depended on the professional judgment of the owner, the health of the owner, the health of the practice, and the moral particulars are offices may see different populations. We know that a pediatric office, once we reopened, probably had way more to do to fix their office up than perhaps a periodontal office that had single rooms and doors. They might have had air filters, but the pedo office was an open air concept. So there was more that needed to be done. And so before we jump to conclusions that someone didn't do enough in their office, we need to recognize that practices are different. And justice, I think we should treat others like we would like to be treated. All right, this often gets neglected. What do we owe ourselves? Because we do owe ourselves something. We did a lot of training. We've invested a lot in our practices, and we do have something that we owe to ourselves. So autonomy, your training entitles you to professional judgment, and no one can remove that. You need to treat according to what is important in your area and what the rules are, but you also need to take into consideration your training and what you know for sure. Do no harm. You need to make every effort to protect yourself. You do not want to get sick, infect your family, your patients, or your friends. Do some good. You need to make money. You need to pay your bills, and you need to do good dentistry. Justice, you need to be fair about fees. You need to acknowledge your team's fears, and you need to recognize your own limitations. And then veracity, be honest about yourself, your health, your risks, because no dollar amount is actually worth your life. So here we are in a real world application about wearing a face shield. And I talked a little bit about during HIV, these came into fashion and then they left. Well, they may be here to stay. I don't know. And I also want us to remember that we're living in real time. What I say today, 6 months from now, may not be the right decision, but we're living in real time and we have to make decisions in real time. So back to my deontology. We know there's rules about aerosols, and we know that face shield would make a big difference in getting aerosols on my face. But my competing rule is good dentistry. I can't see through my face shield. This is a problem. And I need to be able to do good dentistry. So the moral particularisms are, how am I screening my patients? Do I know that they're not sick? What kind of procedures do I do? And am I behind a microscope, which would put me much further away from the patient if I'm not? That's an important particular. Justice, I don't want to bring something dangerous home to my family. I don't want to get sick. And veracity, what happens if I do get sick? Am I going to have to shut down my entire office? Well, that has some pretty serious ramifications too. So when I'm thinking about wearing a face shield versus not wearing a face shield, I need to recognize that the self-sacrificing dentist is not always a good thing. I need to make sure that I am doing things that take care of myself and my team and still allow me to do good dentistry. So I just want to share a couple of optimistic things. We recognize this is an opportunity. We have incredibly clean offices. Since the 1980s, when we had to deal with HIV, dentistry has stepped up, and we should share that. People need to know that we've always had great infection control. Our offices have always been clean. And this is an opportunity for us to tell people that. It's also this amazing opportunity to talk to patients about healthy habits and their overall health. You know, people are sometimes staying home. They're not going to work. They're working from home. They're teaching their children. And their habits may be off, which means they're not going to bed at a normal hour. They're not eating their vegetables. They're not brushing their teeth. There's never been a better time to open up that discussion about oral hygiene and where it fits into their habits. Utilize it. It's great. Finally, this is an opportunity for us to be a leader and example in our community. You know, leaders aren't born when things are fabulous. Leaders are born when things go bad, and we are in bad in 2020. So step up. What can you do to encourage your colleagues? What can you do to help your community? There's lots of opportunities here that probably weren't here a year ago. So try and be a leader. See what you can do. Finally, just be kind. Recognize that we are making these decisions in real time. We may not be doing things perfectly, but we want to do the best we possibly can do. And we are all in this together. Thank you. Dr. Letran, are you there?
Yes, hi. Well, thank you so much for sharing all of those insights. And I totally agree with you on what you say. You know, there's the responsibility in every one of those situations. You talk about being honest, right? Veracity. And I think, and it's one of the reasons why I get into high performance coaching is the very first person we have to deal with is ourselves. Because if we are not honest to ourselves, it's going to be very hard to try to go and be honest with each other. And I like what you said when you say details matter, right? It's interesting how in our workplace we are very detail oriented. A little margin of ridge, a little the where the composite meets the tooth, right? The margin on an implant crown, you put the crown in, then you take a bite wing, and then you actually cement it, and you take another bite wing, right, to check and make sure that there's no cement in there. I mean, all of these things we do are so detail oriented, and what I like for people to do is whatever that is, that detail oriented mind, that you care so much about your little implant crown, you need to take that and apply it in your everyday life, right? And apply it to everything you do for the community, for your team. And so it's great that you remind us, because everybody knows, right? But not everybody does it. You remind us that the details really, really matter. Have you ever been uh, reminded by other people, hey, you need to pay attention to the details in your work?
I tend to be really detail oriented. But I do think that's part of coaching, just like what you're saying. You know, when you step back and look at all the details, the little details really add up to a good outcome. And that's not just true in our dentistry, it's true in how we treat our patients and how we treat ourselves too. If I don't eat a good breakfast, if I don't get a good night's sleep, if I don't take care of my body, well, my dentistry does suffer. And those are the details.
Right, and that's the details that you take care of yourself and you owe it to yourself, right? And
Yeah.
and then you carry that, and that's how I think that's part of the reason why sometimes it's easy for us to coach our patient, because we know that if our patients don't take care of their body, it ultimately will affect their teeth, and they show some of those signs when we do the exam. So it's important to pay attention to detail. It's important to draw the big picture, especially on the topic that you're talking about right now. Sometimes we think, oh, I'm in my little practice, I'm just going to do this. It doesn't really matter. And it's interesting to me because just like you, I'm in a lot of the Facebook groups, and the private Facebook group, right? And the discussion there sometimes is not the same as whatever it is that we are saying to the community. So I'm going to bring up something and see if you can answer it. How do you feel about all of this price gouging? Is that what you said? Where everybody just raising the price. I mean, I have dentist friends who all of a sudden want to sell PPE, right? And I'm sure they care, but right now at this moment, everybody there's a bunch of people jumping on and wanting to sell PPE, and at obviously different price points. So what do you think about that?
I guess I believe that our community is really important and we need to take care of each other. So
Mm-hmm.
price gouging with our PPE is not benefiting our community. And in fact, I would say that it was causing harm. Now, it may be benefiting one person, but that's not ethics. Ethics is when we're looking at the entire situation.
Right. So do you ever find yourself wanting to tell a colleague um, certain things, like cut it out, like don't do that?
I do.
I guess on a personal level.
I mean, of course, we all do. But I've also learned that, again, the details matter. So sometimes my perception of what's happening somewhere else isn't
Mm-hmm.
accurate. And so it's really important that if I'm making a phone call, that I listen. I listen to what this other doctor is saying, that I understand where they're coming from. And sometimes people make mistakes. It's life. And it's our job as a community to be encouraging and help people get back on track and not be blaming them.
Do you think that because I do know, but I'm just kind of talking for everybody. In general, do you think we can enforce ethics?
I
I know there are laws and things like that mandating certain things, but do you think, and it's a personal question, do you think that's something that we can actually enforce?
I don't know about enforce, but I think we can definitely make it a community standard. I think
Mm-hmm.
oftentimes when it's a law, the reality is a politician has no idea what we do and what's actually ethical. Even our judicial system, they don't always understand what's ethical. So we as a community, we should support each other. And I look at it as supporting each other and not tearing each other down. We don't want to call and be cruel to each other. We want to lift each other up by making PPE affordable, encouraging people to do their best work, um, being paid appropriately for your work and doing good work. And we want to
Yeah.
encourage.
Yeah, so you mentioned the dentist down the street, right? And I'm reading that as everybody around you, and sometime when we part of it is a little bit of a scarcity mindset where you worry that there's not enough to go around patients wise or production wise, whatever you want to call it, and then sometimes we act in certain ways that doesn't go right along with our ethics. We always hear about businesses or professionals sometimes bad mouthing each other, right? Um, Very common is when a patient come in and say, "Oh yeah, it's that doctor down the street, and she just put these crowns in," and we don't watch ourselves in saying what should be in the best interest of the patient and of the other doctor. So for me personally, I just tell the patient, today on this picture, this is what I see, right? I don't know what happened 6 months ago, a year ago, but this is what I'm seeing today, and this is what I'm recommending. You can go back to the last doctor and have it checked, or I can fix it for you. But all I can talk about is what it looks like today. Do you have any better
Oh, I
recommendation talking
Well,
about
I've
that?
I've made that big mistake before where a patient came
Okay.
in and this doctor that I respected so much and I just thought she was the best doctor ever and the work was terrible. And so I didn't
Okay.
exactly say that to the patient, but I got in there thinking my big ego that I was going to do a better job. And by God, after a while, I was like, this is going to look exactly the same. because this patient is so difficult. So it's important to recognize that, yeah, the details matter, and I can't just throw somebody under the bus. At the same time,
Right.
yeah, had it been a situation where this patient was easy to work on, maybe a phone call is important to call. Is this other doctor okay? I mean, I had so much respect for her. If there was something that went wrong, maybe something has happened to her and I need to be a community leader and check on her.
Yeah. I want to share with you a quick story. And there's certain things that we learn in dental school that we carry with us forever.
Yes.
And I and I remember, I think the class was probably ethics, but I know they were talking about it. I don't remember the class, what the class was called, but the professor showed a picture of a bite wing and a whole quadrant dentistry, and everything was overhang, right? And this is late early 90s, so amalgam overhang, like the whole thing. And you're looking at it and you go, this person either is not seeing very well, or maybe this person didn't put a matrix band on correctly. Of course, as dental students, we were all gasping, right? Wow, like this. And then the professor proceeded to tell the story that that's exactly how, I think it was a lady, like how she felt, how bad the dentistry was. And this is, 2 MOD, 3 MOD, 4 MOD, 5 MOD, that kind of a thing. But when she asked the patient to open, the patient opened 2 fingers width.
Yeah.
Right? And now we're all going, wow, such great dentistry. Because how did you get back to number 2, right? To do the work. And because we don't know the story, and we come to conclusion too early, and then on the other side of the spectrum is we do know everything, but we just decide to do something that is really not in alignment with our ethics and what we know is best. And I really appreciate you bringing that up, kind of reminding everyone that nothing is perfect. We're always going to have challenge. We're always going to have, if it's not this pandemic, it's going to be some other kind of things that will stir up our profession. And there's going to be words flying around and high emotions, and how do you keep calm and stick to what you believe?
But I think that's the big thing is you need to decide what it is that you believe and how you're going to behave. And you decide before you go into the office that I'm going to do the best dentistry I possibly can do, and I'm going to be ethical and make great decisions. And then the second thing is I'm going to believe in my colleagues and think the best of everyone. And there is an abundance. Everybody has teeth. And if they don't have teeth, they even need more. So there's a huge abundance of people. There's lots of work. We can all uplift each other and it will be fine.
Yeah, that reminds me of my introduction at my local senior group. We have a bunch of business providers who cater to seniors, and I would always introduce myself that I work with people from 2 years old to 99 plus, and I work with people with teeth and without teeth. And everybody just crack up, right? That's pretty much everyone, whether you have teeth or not. And so sometimes I think when hard times come, it helps to just pause and think about everything that we've accomplished, because there were hard times before, and just revisit those values when it was hard. What, right? Did you stay true to your values? And now just another one. And like you said earlier, with great power come great responsibility. The better you are, the more challenges they're going to throw at you, or life's going to throw at you, and we just learn to step up a little bit every time.
Well, you never want to be the person that shirks away from challenges, because then you're the person that's doing root canals by hand still, or you're using silver points. You have to stretch and grow and try things that are difficult and accept challenges. And sometimes
Yeah.
you don't go well, but you always make it right. That's what you do.
Right. So I understand you teach the course on ethics for the ADA. Do you teach it mainly to, I think you mentioned to dental students, or is there a course for people like me?
Well, the ADA Success Program goes into dental schools, and I like to do the ethics one. So I like to go
Okay.
into dental schools and talk about ethics. I think it's fun, and not everybody enjoys that. I've done a couple online, one for you, and then one with the Arizona Dental Foundation, and that's 3 hours. And I have my son and another dentist that are all talking about the ethics of this pandemic.
Wow. So how do people reach out to you to learn more about your courses? And I would love to have you come to the next event when we can actually see face to face, right? And not through a tiny yeah, and not through a tiny little screen. Where, because sometimes, you know, when you see people and you're bringing up an example, you can see emotions boiling, right? or you can see people, what's running through their head is, yeah, she's talking about me, right? I'm the one who didn't wear this and buy that. Um, is there any how do they reach out to you? How do we reach out to you to learn more about what you do?
You can certainly email me, and it's Dr. House, and you spell it Doctor, Doctor, House, House, at msn.com. You can also download my podcast. It's on iTunes, and it's called The Authentic Dentist. Or
okay, and do you plan to do some courses or some training on this for other? I know you say you did it for the Arizona Dental Society. Do you plan to do this for other dental societies, or if other dental societies want to reach out to you and bring you in as a speaker, or maybe somebody from India want to bring you over there? Hint, hint, hint.
I would love to teach on ethics. I think it's fun. Florida asked me, but then we had the pandemic, so I didn't go to Florida. So
Okay.
I would love to speak more. I enjoy it.
Okay. Okay. Do you have any last words for our international audience? I'm trying to look at the screen here. I don't see any other questions right now. Any last comments, insights, advice for our international audience about being an ethical dentist, asking ourselves the question, what do we owe to each other?
I just really think it's important that we remember that we're working in real time, and that perhaps the answers we have today won't be the answers that we have in 6 months, and we need to be flexible and keep moving forward. And I think that we all need to recognize that we want to lift our profession up. Everyone else wants to bring us down. We need to lift each other up and encourage each other, and remember that we owe each other this. Thank you.
Great. Thank you. Thank you so much, Dr. House, and thank you to our international colleagues, friends, everybody who's watching this broadcast. Learning from Dr. Allison House on how to think about what our responsibilities are, to revisit and hold on to our values, to be very clear in what we're supposed to do. Like you said, you decide that before you get to the office, right? Not just when a difficult situation presents itself. You're going to decide that. And coming from me, I think it's really important that you try to practice that every day. You don't need a pandemic to remind you that you need to be ethical. You should just be your best self every day if you can. And so thank you, everyone. I hope you have a great rest of the day or night, wherever you are. We have people across the world, so it's a little hard to tell the time. Thank you for joining us, and keep in touch, because we are here providing values, sharing knowledge, and helping us creating a better profession and better life.